What is that? Like how, okay, just explain to us when someone comes here for pain management, what exactly are they coming to get rid of and where mostly?
Okay, so pain management is basically stem cell therapy. That's what I do for pain management. It's not my specialization, but because I've specialized in stem cell therapy, I just help out my patients who deal with chronic pain. So pain can be anything. It could be damaged muscles, it could be post-surgical, it could be post-accidents, it could just be natural pain like patients suffering from arthritis. So we literally treat the whole body. It could be anywhere from the head to the toe. And I commonly see a lot of patients who have pain in the knees. It could be because of arthritis or just damaged tendons, ligaments. And so what happens is we are regenerating the muscles, the tendons, the ligaments, and the cartilage. So it just helps you function better. So 3 sessions of the treatment and the pain is gone completely. And now you're back to normal.
Amazing. So can I throw one for you to debunk?
Yes.
That once you sit too long consecutively for several days, the back starts aching, right?
Mm-hmm.
Is it true it's because of sitting down for too long consecutively, or is it?
It's actually yes, it is the posture. So even if you're sitting down consecutively for many days, you're not sitting in the right posture. Your chair could be not comfortable. You're probably slouching, and then that one position is going to freeze your muscles anyway. So yes, it will bound to create pain.
Oh, how about the mattresses and the pillows one uses? Could it contribute to that?
Yes, it does. If you're using too old a mattress, then it's already deformed. It's not helping you sleep in the right posture. Mm-hmm. And sleep is the most essential thing. So if you're not sleeping right and you're not having enough sleep, then it's going to, work out bad for the rest of your day as well and your lifestyle in general.
Yeah.
And so everything matters, from your pillow to your mattress to how you sit to whether you exercise or not, how your lifestyle is, even your diet to that, matter. Yeah. All that affects.
PRP.
Yes.
Please explain that to us.
Okay, so PRP is, the stem cell therapy I do is a form of PRP, but it's advanced PRP. Mm-hmm. And so PRP is platelet-rich plasma, where somebody takes your blood, like a blood test, puts it in a machine and separates the blood from the plasma. And that plasma is technically injected wherever in the body. So plasma is known to be a version of stem cells, which regenerates anything in the body. However, when we say we do stem cell therapy, we're doing something called growth factor concentrate therapy. And the difference between the PRP and the GFC, which is the growth factor concentrate, is that in your blood, you have growth factors, and standardly, you will only have an output of about 40 to 60% of growth factors. But when we're doing a GFC, we already have a gel which is in the tube before processing, which extracts a full 100% growth factors. So the GFC we do is 40 to 60% better than the normal PRP. And we use it for hair regeneration, for skin regeneration, and for pain management.
So do you normally use the GFC when it comes to hair shock loss or the PRP?
I don't do PRP at all.
At all?
No.
So GFC?
Yes.
And it's more preferable. Do you do it after the hair shock loss or during the hair transplant?
So it's a procedure done after the hair transplant. Mm-hmm. Although if you're not balding and you just want to maintain natural healthy hair, then you can just use it as a maintenance treatment.
Okay.
Yeah.
Laser. Who are the most common clients you get for laser? Is it men? Is it females? And why?
So laser hair removal?
Yes.
Both.
Oh.
Yes. It's a 50-50.
Yeah.
Because men are also so conscious these days and they don't want a lot of body hair.
Yeah.
So we get a lot of men who come in to get their chest hair removed, armpit hair removed, beards removed. Because I've seen it's a thing that a lot of men don't like beards these days. So, but there's again a 50-50 there as well. And women, of course, we just like to be hair free.
Yeah.
So they also come in for a full body laser hair removal.
So it's safe to say that being an aesthetic doctor does help build one's self-confidence a lot.
Yes, it's so necessary these days because we all are about looks, and you have to portray yourself no matter what profession you are in. And I think everybody these days wants to look good. And it's also a concern. Back in the day, nobody bothered about how you were looking, how you were dressed, but everything is so much more advanced now. And so is why we're here, because we can treat those problems. We also treat stuff that's very basic, like acne, razor bumps, all these things as well, which really matter, which are core to aesthetics more than luxury aesthetics.
True.
And so, yeah, we're building your confidence anyhow.
What would you say to anyone who thinks that such services in Kenya are not really good or there?
Yes, it's true. I would probably be one of the first ones to be around doing these. I do have a few seniors and colleagues who do it as well. Mm-hmm. But look, we're learning. We've gone through advanced technology. I've trained myself in Germany, so I'm coming from the best. And so you don't need to take a flight to go and do these things somewhere else. We're right here.
You had it right here on So Portable. So the services that you offer right here, it doesn't necessarily have to be for a certain age group, right?
Yes, that's true. I say it's never too late or it's never too early. Mm-hmm. So you can do any procedure that you want, although I only treat adults. So anybody above the age of 18, unless it's cases like acne or severe hair, which is hirsutism, because of underlying diseases or conditions. But otherwise, yes, it's never too late or never too early.
Do we have many clients who come for the chemical peel?
Chemical peels are not a go-to for me. Yeah. I only use them for acne treatment and sometimes as a combination for depigmentation or skin brightening. But ideally, chemical peels don't work on Indian and African skin or darker skin types. Yes, because it comes with a downtime of hyperpigmentation after. So technically, it's a really long period for you to heal because of being a darker skin type. And so you'll find yourself like 6 months or 8 months to a healing process, which is not what anybody wants. You want to look good. Yeah. And then if you're going to give 6 to 8 months to it, it's not worth it.
Now, talking about self-confidence, most of us ladies worry about our weight. And you do have weight management.
Yes.
So what basically do you do here when it comes to weight management?
So we have a combination. We have an IV drip that helps you lose weight. We also have fat loss injections, which are known as lipolytics. And we have metabolism boosters. So we use a combination depending on person to person, but we also provide nutrition services. So we have a nutritionist on board who can, do a meal plan for you because it goes hand in hand. You have to stick to basics, which is the diet and exercise. Yeah. And we have a small gym outside. So everything is under one roof.
IV injection.
Yes.
How does that work?
It's a drip which consists of lipolytics. So lipolytics are fat loss. It basically cuts down the fat in the body. So the fat comes out of your body. And then it consists of amino acids, which builds muscle. And it consists of metabolism boosters, which boosts the metabolism. So whatever you're eating is just not stored into fat, it's turned into energy. So that combination helps you lose weight.
Oof. There we go. Did we cover everything?
I think so. Almost all of it. I also spoke about acne, just basic treatments, razor bumps. We've spoken about laser, and of course then the main. But yes, there is something that we do called antioxidant therapy, which mainly for me in aesthetics is for skin brightening, not whitening. So, basically we help you get rid of pigmentation in your body. So, we're all pigmented, at least head up or the hands, because whatever is exposed to the sun is always darker than the natural skin color. And so we help you get to one color. But it's also an immunity booster simultaneously and also an energy booster. Because it's in the form of an IV drip, it boosts your energy, boosts your immunity, and now lightens your skin. But you don't become white.
Okay. Thank you so much. It's been a pleasure having you here.
Thank you too.
I think this is our 3rd episode of So Portable.
Okay.
And you're always welcome.
Thank you.
I think I will bring my mother here at this point.
Yes, please.
There we have it, guys. Thank you for joining us. Please stay tuned for the next episode. And as I always say, everything and every episode keeps getting better.